My name is Simon Abbott. I'm a senior lecturer at the university, and I'm involved in a number of things, but including the best interest assessor module. You've joined today for a webinar on implementing the approved mental capacity professional role. And this is a lessons from an early stage implementation study. I should start really with a caveat. I don't want to hear lots of dings and people leaving, but we're aware that there's a huge appetite in the sector for information and knowledge about the liberty protection safeguards and the approved mental capacity professional role. And there's a massive appetite for knowledge of, regulations, codes of practice, putting meat on the bones of the mental capacity amendments. This session isn't going to provide kind of that rational, technical, sort of legal update knowledge. It's going to talk to you about an implementation research study. So I haven't heard lots of dings, people leaving, but just wanted to set that caveat. So from ADAS, who have got a question and answer session that's been advertised, and I'm sure people here who have got an interest in mental capacity will know that there are sources of information out there that provide that kind of legal update in relation to the LPS. Anyway, I don't want to get too sidetracked with telling you what I'm not going to do, because I don't want anyone to leave at this point. But yeah, the study, we're looking at an implementation of the approved mental capacity professional role. And it's an early stage implementation study. And we'll say more about that. The research team are myself, Simon Abbott, Maria Brent, and Rebecca Salama from Kingston University. And the study itself also involved people with lived experience of social care via a project advisory group. And this aimed to connect, policy and evidence to the experience of people with lived experience. And this group helped to design focus group and interview protocols, and will be having a further role in a later workshop. So a quick kind of overview. What are we talking about when we talk about liberty protection safeguards? Well, the Mental Capacity Act, Mental Capacity Amendment Act 2019 is designed to protect the rights of citizens who lack mental capacity to make decisions because of an impairment or disturbance in the mind or brain. And within this framework, the liberty protection safeguards aims to protect the rights of citizens who are unable to consent to care that amounts to a deprivation of liberty. And the liberty protection safeguards will provide protection for people aged 16 and above who are or who need to be deprived of their liberty to enable their care or treatment, and who lack the mental capacity to consent to those arrangements. So this is the liberty protection safeguards and the amendments represent a really big shift in policy, in that deprivation of liberty under this new framework becomes everyone's business, and not just best interest assessors in local authorities. So it extends to different professional roles, and it notably extends to different responsible bodies, different types of organisations who are now going to have a stake in this. And the LPS also introduces the approved mental capacity professional role, and hereafter it will be referred to as the AMCP role. And that role provides additional scrutiny in cases where there's reasons to believe that the person doesn't wish to be in their particular setting, and also where they're in cases where someone's in an independent hospital. So just some headlines here. The big shift in policy applies in any setting, applies from age 16. There's a new, quite diverse range of responsible bodies, ranging from CCGs, NHS trusts, local authorities, and local health boards in Wales. And as I've said, it introduces this new approved mental capacity professional role. And the sort of a quick recap on the kind of conditions and criteria. Well, there's going to be different components: mental capacity, mental disorder, and an idea of necessity and proportionality. But we'll come to more of that a bit later. So, what is being asked of the AMCP? Well, the role is to review the information and decide whether the authorization conditions are met, and those are mental capacity, mental disorder, necessity, and proportionality, and also to take any other action provided it is appropriate and practicable to do so. And we don't really know what that's going to mean or how that's going to play out in practice, that particular provision. So in some cases, not all cases, AMCPs will carry out pre-authorization reviews to determine whether the authorization conditions are in fact met. So that's a kind of a very brief whistle-stop tour of LPS and AMCP, and just to sort of explain these definitions to you that we're going to be talking about. But the real emphasis here in this webinar is the study itself. And the background to that is the aims of the study are to examine both barriers and enablers that will impact on implementation of the approved mental capacity professional role introduced in the protection safeguards. Why are we doing it? What's the rationale? Well, perhaps I'll just start with the sort of motivation to carry out this study. Myself and colleagues are involved in best interest assessor education at the university, and we work with partners, and that's involved more recently recognising the challenges that our partners were facing in terms of implementing the liberty protection safeguards and the AMCP role. So really we wanted to explore what the barriers and enablers were in terms of implementation. Further rationale really for the study is that there's a lack of research and policy engagement on the new approved mental capacity professional role. And it's an important area of policy and practice given the strategic significance of the AMCP role. It's important to understand stakeholder perspectives and the conditions impacting on the adoption of mental capacity policy at the pre-implementation stage. Okay, the challenges implementing mental capacity policy will be well known to many people on this call. So the complexity of implementation of mental capacity policy into health and social care systems and practice is fairly well documented. And in fact, parliamentary scrutiny of the Mental Capacity Act and the deprivation of liberty process that precedes LPS, DOLS, found that it was unfit for purpose. So appeals for effective monitoring of service delivery have highlighted the time it takes to fully implement complex social care policy and to gauge the legislation's impact on a range of stakeholders. And this includes service users, carers and families. Really what this speaks to is that it's not translating the law into health and social care practice is not that simple. There are about 3 decades of research that make that case. It's not just a simple matter of just having knowledge of legal rules, although that is imperative, but it's a more implementation of policy into health and social care systems and practice. It's necessary then to understand stakeholder perspectives and conditions impacting on the adoption of the AMCP role at this very early stage, this kind of pre-implementation stage. And the study also answers the need identified by NICE for qualitative research that explores the barriers and enablers to delivering effective training and support, and qualitative research that also explores the challenges that practitioners face in practice. So that's our argument, really, in terms of the rationale, in terms of why this kind of study is important and why it's important at this kind of pre-implementation stage. Because, you know, insights from implementation science reveal that this early phase of implementation will affect later sustainability of policy reforms, such as the LPS, and can help shape successful longer-term implementation. So learning lessons at the early implementation and pre-implementation stage can help guide and inform successful longer-term implementation. Okay, so I hope I've convinced you why it might be important to look at implementation at this stage in terms of the LPS and AMCP. So briefly, the conceptual framework used in the study draws on policy implementation research field and also aspects of the implementation science research field. And the emphasis in this study is a bottom-up perspective. So it doesn't take a top-down perspective where we start off with what are the aims and what does the policy intend to achieve. Instead, it goes from the bottom-up perspective. And this challenges the view that implementation is a purely administrative or rational technical process. Rather, it takes into account the important role of frontline policy actors who will actually implement and put the LPS and AMCP role into action. So subsequently, the focus of our study interest is on local implementers. We also draw on a stakeholder analysis framework as a practical tool to analyze the characteristics of our stakeholders in our study, who are policy actors. And there are four areas or four characteristics that we look at to organize how we understand these policy actors. And they are knowledge, interest, power, and position. So just a quick definition of each of those. So knowledge, here we define that as stakeholders' knowledge and understanding of the policy, which for many of you on the call, you will note that that's a real challenge when it comes to LPS. Interest, and that refers and is defined as the stakeholders' motivations and perceived impact of policy implementation to their own organisation. The other characteristic of stakeholders that we're analysing is power, and that's the potential ability of the stakeholder to affect policy implementation. And finally, the final characteristic in terms of our analysis is position. And here that's defined as whether the stakeholder supports, opposes, or is neutral about the policy implementation. So that's a bit about, me convincing you why this question is important, why this area of study is important, and some information about the kind of conceptual framework that informs the study. I'm going to hand you over now to my colleague Rebecca to look at the study design.
Hi there, everybody. Good afternoon. As Simon said, I'm Rebecca Salama, another member of the research team. I'm going to be taking you through an overview of our study design and methods, and then the exciting bit, reveal some of our initial key findings. So we wanted to answer questions relating to the experiences and perspectives of those who will be directly involved in LPS and the AMCAP role. So for this reason, we chose a qualitative approach, and we recruited participants from 2 large local authorities in England. We started by holding 2 focus groups. The first was with key informants occupying MCA leadership roles, who have responsibility for operationalising, can't ever say that word, the LPS. And the second was with social workers who are qualified as best interest assessors and who intend to transition to their new role. So the purpose of these focus groups was really to encourage discussion and debate amongst participants. We then held semi-structured interviews with the BIA group to get more in-depth, one-to-one understandings of their personal experiences and perspectives. So in terms of data analysis, we're currently in the process of analysing the data. And to do this, we're taking a reflexive thematic approach. This involves coding the data to identify patterns and themes. Once we finish this process, we plan on running a workshop involving all of the research participants. And this will give us an opportunity to cross-check our analysis and to prioritise the key themes that we want to present in the final paper. So, some early findings. As I mentioned, we're still in the process of analysing. So just to caveat, what I'm going to share are some of the initial findings that have emerged over the past few months of work on this project. And hopefully these will spark your interest in following our progress and reading the final paper we produce. So the good news is it wasn't all doom and gloom. That might not be what you expect from a study about, well, it might be what you expect, doom and gloom, from a study about policy implementation. But actually, we had many positive viewpoints from participants, many who expressed genuine optimism about the changes, both in terms of the LPS legislation and the new AMCP role that accompanies it. So starting with the legislation, there was general agreement that there was a need to reform DOLS. It wasn't fit for purpose, that it needed to be simplified, we need increased efficiency, and that this was really an opportunity for many more people to be involved, covered by some sort of safeguard. There was also a lot of people expressed that they liked the human rights focus, and that they liked the fact that the starting point for LPS was safeguards rather than the deprivation of liberty, and so that it was strengths-based and people-centered, those kind of phrases that we all love. And another theme was that it had the potential to be preventative, that it could stop cases going to court, that there was more opportunity for negotiation and resolution at an earlier stage, so we could get to people sooner and put them in give them less restrictive options. So in terms of the AMCP role, all participants recognised that this was going to look and feel very different to the current BIA role. Many of the current BIAs were excited about the potential for more autonomy, greater influence, a wider scope for creativity. They spoke about the opportunity to have more meatier, more involved cases, more variety, and more face-to-face interaction. They also spoke about whether this role would sit at the same level as an AMP, which would signal greater recognition and responsibility. And finally, they spoke about team working, saying that this had been, they expected that in their role as a BIA, but it hadn't always been the reality. And the ways in which they could work with other stakeholders to increase general knowledge around the Mental Capacity Act. So the first barrier that I want to talk about, a frequent answer that came up, especially in the BIA interviews, at the beginning, the middle, the end, the whole way through, was, I'm not sure. And this really highlighted how many uncertainties and unanswered questions the BIAs themselves have concerning this policy shift. I'm sure they're the same sort of questions you have yourselves, and which we certainly have. So what is it going to look like? How will AMCPs be involved? Will they be in frontline teams? Will they hold a caseload? Where does their role start? Where does it stop? And without this detailed information, there was a worry that, is this really a simplification, or are we actually complicating things further? And also, how is this moving? How's this moving with case law? And also, how is this going to fit in with current reforms to the Mental Health Act? And so the final question that I've put there in the centre, what everyone was asking, is where is this code of practice, and when are we going to read it and truly understand what's going on? And this lack of clarity, I think, it came across as genuine anxiety, and inability to plan and prepare was a real barrier that many people mentioned. And then moving on, so I started by explaining the optimism that many participants had about the potential impact of this legislation and role, most notably its focus on human rights and person-centered practice. But those comments were very much at a theoretical level, and they were about what participants thought could be possible, what they hoped was the government's intention behind the policy shift. But when it came to discussing the reality of the implementation, there was much more skepticism, and more concerns were voiced. And so one of the key concerns was around the loss of the BIA role. This was interesting for us because we tend to focus on the new. So what is the AMCAP role bringing? What's going to change? But actually related to this is the question of what might be lost. So in particular, participants were concerned about the loss of independence. So as one current BIA told us, we provide a specialist, impartial service free from external pressures. We shine a spotlight on the person and can sometimes see what those working with them every day cannot. Someone might tell us, oh, that's just Bob. He's always grumpy. But we have the ability to go in, spend time and find out, is Bob always grumpy because he's grumpy, or is he grumpy because he's not actually happy being where he is? And so there was a worry that without the BIA role, there would be less scrutiny, and we might not be able to go about doing safeguarding in the same way. Related to this was the fact that the sheer numbers of people to assess was going to require resources and a pace. Well, it was going to require resources which maybe weren't there, and it was also going to require AMCAPs to work at such a pace that perhaps there wasn't going to be time to actually listen to a person's wishes and views. And that actually what could happen is a watering down of the legislation. They also spoke about the impact of COVID, and that, as one participant said, we're going in on the back foot, considering what's happened over the past 2 years, especially in care home settings. Are we going to be ready to implement this effectively? And then related to this was a lack of workplace knowledge. So people spoke that there's already a current gap in terms of knowledge around the Mental Capacity Act and skills and implementing DOLs, and that we're not where we should be. So to bring in a whole new set of legislations is going to be quite difficult. And so, yeah, ultimately, basically less time to look at the individual was the worry. And then the final barrier I wanted to discuss was some of the specific findings, specific challenges that were raised by the new service groups that will be included under LPS. So starting with self-funders. So many of these will not have had any contact with services and won't have an existing care manager. And this brought up a couple of concerns. One was, we're going in there blind. We don't know anything. How will we know if they've, there's a deprivation of liberty, for example? And then on the other hand, if they don't have an existing care manager, will they be referred directly to an AMCAP? In which case, will that create an unfair playing field between people who are already engaged with services and those who are not? And then the big one, I think, is community settings. So recognizing this is a completely different dynamic to working in the way that the BIAs have done before. So it brought up lots of issues. For example, going into people's homes, how do we get access? How do we assess the risk for the people themselves and also for professionals? And that many BIA said, we've been out of the community for so long that we sort of have a lack of knowledge about the setting and the support that we can signpost people to. Then there were some other more concrete examples. So, for example, what if we go to a home of somebody who we've told is not eligible under the Care Act for care and support, and then we're suddenly here under this LPS legislation intervening, and will they understand that? And we have to be very sensitive to make sure that we're allowing them to participate and that they're going to be open and not resistant to our input. And finally, then in the 16 to 17-year-olds, so there were some participants who said that there's a massive need for upskilling here and recognise some of the challenges in engaging with and working alongside children's services, because this is not a service user group who they have experience with. In terms of finishing on a positive note, we heard how people are very optimistic. But then there are some barriers, but they're also very aware of the type of things that would help them to overcome these barriers. So training was a big one, and not just e-training. I heard that quite a few times. Actual clear process-driven training that's going to help with the implementation, and recognizing that this is not just a couple of days to update from being a BIA to being an AMCAP, that it's more complicated than that. But something I think that surprised us somewhat as researchers was that nearly every participant mentioned the need for public communication. And this was a potential facilitator that clearly emerged from our initial data analysis. Many of them mentioned how a lack of public understanding was currently a massive barrier for DOLs, and if this isn't addressed when LPS is introduced, then the implementation of the policy shift is likely to be unsuccessful. So one participant said, do people even understand what a deprivation of liberty is? Do they realise it can occur in any setting? That it's not just if your mum is in a care home, that it can even happen if she's being looked after in her own house. And in this sense, how do we expect families to understand what we are saying no to when we say something is too restrictive? So currently, everyone recognises that there's a lack of personalised and meaningful information that professionals can signpost people to. They spoke of the need for clear information, free of jargon, something that can be provided before the intervention, not just in the middle of a crisis when people are naturally going to be more resistant. They spoke about how incredibly hard it is for people to retain and process complex information when they were lost in what one participant called the foggy mist. And this led many of them to talk about the need for a wider preventative campaign, one that explains the difference between lasting power of attorney and next of kin, one that explains rights, advocacy, legal aid. Another participant said, the government broadcasts public health messages telling us to wear our seatbelts. Why don't they also tell us to get our lasting power of attorney for health and welfare in order? So essentially, one of the strongest findings coming out of the initial analysis is that the arrival of this new role in legislation offers an opportunity to raise public awareness and communicate effectively. And many seem to believe that if we can do this, not only will the implementation be successful, but we may be able to actually facilitate a shift from crisis management to prevention.
Thank you for that. So really, we've kind of galloped through that, and I think it's time to focus on the discussion really of our initial analysis. And I suppose the first, we want to discuss two main points in our discussion really. And the first is that, our initial analysis raises that, for us, that implementation efforts in relation to LPS and the AMCP role may benefit from alignment with the values and motivations of professional stakeholders, including a focus on the context that they operate in. So for example, there was a lot of enthusiasm there on the first slide in terms of the first set of findings that you spoke about, Rebecca, on enthusiasm about the AMCP role and LPS enunciating this possibly more autonomy and scope for more creativity. And participants were kind of focused on this enhanced status that the AMCP role, that they thought the AMCP role would bring. And so many of them spoke about feeling that the status of the AMCP was enhanced above their BIA role, and that it was in some ways in line with the AMHP, the AMP role, the approved mental health professional role. So there's a real kind of opportunity there in terms of the values and motivations of professional stakeholders, being interested in this role, bringing with it some enhanced status. But there's also, alongside that, there's a risk really, because whether or not the approved mental capacity professional role will actually enunciate this kind of equality of status between the AMHP and the AMCP is not very clear. And how that's actually going to play out in terms of the level of trainings and the content of the training that the AMCP will receive isn't very clear. But actually they are different roles, aren't they? So whether or not they could or should be at some sort of equivalent status is arguable, I guess. But there's certainly, in terms of the motivations and the values of professional stakeholders, we think there's a real opportunity for best interest assessors who will become approved mental capacity professionals to upskill the mainstream workforce. So that's a real opportunity, we think. And all of the participants we spoke to were really kind of anchored to this commitment to rights-based approaches and for being sort of a champion of human rights. And there was some concern that could be lost. So I think it's important for training and the identity of the AMCP role to be very much aligned with the motivations and the values of the professional stakeholders here who want to continue to be human rights champions. And there are some really, I think there's some really encouraging signs in the sector actually that seem to, would seem to align those kind of values and motivations around human rights oriented practice with the proposed conversion, certainly, of the conversion of the best interest assessors to become AMCPs. So there's some really, I think there's some encouraging alignment in the sector that would chime certainly with our participants' motivations and values. I can't remember where I saw it, but it was at a webinar. I know people attend a lot of webinars these days, don't they, post-pandemic. But it was a webinar where I think it was Lorraine Curry was talking about the conversion from BIA to AMCP, and that was really encouraging to see. There was a lot of emphasis there on human rights approaches. So there's some encouraging kind of connections, I think. But how we operationalize rights-based practice in these diverse organizations, so local authorities, NHS trusts, CCGs, local health boards, they're quite diverse organizations, and they're going to bring with them different professionals from different professional backgrounds within different types of organizations. So I suppose there might be a risk of a postcode lottery or a professional lottery or an organizational lottery in terms of how rights-based approaches might actually be operationalized and implemented. And I think for the people who are at the receiving end of this policy, I think consistency is really important. So that's something to keep an eye on. Do you want to talk about the second point for discussion there, Rebecca?
Sure. I mean, I've already touched on this theme, I think, but just to raise a few more discussion points. I think it's clear that the new legislation and role represent a huge innovation, and that LPS will mainstream DOLs within professional organisations and casting the net to the wider organisations such as NHS and CCGs. But I think what came out in the findings is it also needs to mainstream the concept to the public at large. There's a statutory obligation on local authorities to publish information on the LPS. So I think one of the questions for discussion is how will they get that information out there, and will they consult and collaborate with people with lived experience, and will responsible bodies democratize their structures to form stronger, more formal coalitions with citizen stakeholders, I think, were the main points for discussion there. Have you got anything to add?
No, I just think that you're right. I think that this statutory obligation to publish information really does chime with this quite surprising finding for us, where people were talking about a need to move beyond mainstreaming LPS thinking to professionals and organisations, but actually mainstreaming it, to the wider public. And participants thought that would be helpful, particularly in terms of preparing people and setting a context for these difficult conversations around deprivation of liberty, which sounds quite scary and needs to be contextualized and understood. Okay, so I think those were the two main points for discussion. It kind of leads us on, before we come to some questions, really it's to look at the sort of limitations and calls for further research, really. So I think the caveat in relation to limitations of the study are important. There's lots we could say about that, but the thing to really focus on here is that, you know, the study was conducted in 2 large local authority sites, big local authorities. So I guess a strength of that is that, you know, we learn a lot about how local authorities and as organisations and how stakeholders within local authorities were preparing and looking at the barriers and enablers that were around for them in terms of implementing the LPS and AMCP role. But local authorities clearly start in a very different place to the other types of responsible bodies, such as CCGs, NHS trusts, and local health boards. They're starting in a really different place because of the legacy of DOLs, really, and BIAs being situated in local authorities. So that really leads to a future study that we're looking at, which will involve a much wider range of organisations, including CCGs and NHS trusts, because clearly things will look different in a local authority to a CCG or NHS trust in terms of implementation. The organisations are starting in very different places. So I think there needs to be that acknowledgement of the implementation strategies need to be flexible, and they need to be able to be flexible to understand the contextual factors across different organisations and how these can be translated into flexible implementation strategies. And also, there's a need, you know, the thing that surprised us in this study, and the thing we want to look at in more detail in a larger study, is to look at research on mainstreaming sort of LPS outside of professional and organisational structures to include the wider public. So I'm going to hand over to Maria now, our colleague Maria.
Hi, Simon. So yeah, welcome everyone. I'm so pleased so many of you could join us on today's session, and I can't see your faces, but I can see some of your names. So as you know, Simon and I have been running the BIA module here at Kingston University for the last 5 years. So I'm sure many of us have worked together alongside each other over that time. Just looking at some of the questions, Simon, hopefully there might be a few more, so please feel free to pop something in the chat. There was a question just asking around kind of diversity and how we break down stigmas and mental health, and I think understanding the situation and the culture of the service user, of people that we're working with under this new system, which I think in a way feeds into some of the discussions we were having earlier around information, making sure we reach the public, making sure that they understand what the role is as well, and also partly part of the consultation process as well, looking at the AMCP role. There's a useful link there to a video that Paula's put. Thank you, Paula. I'm just wondering if anybody else had any further questions about the study itself that they'd like to ask us. Hopefully that you've enjoyed it. As we say, this is early days. These are our early findings. We are hoping to conduct one more element where we'll be able to involve people who've been involved in the study to kind of check in and cross-reference what our findings are. And we know that we obviously have your details now because you've enrolled on the course, and with your permission, you know, we can keep you posted when the actual research paper is published and signpost you to that, and also keep you posted as we've said, we're very much involved here at Kingston delivering the BIA, but we're also going to be very much involved in developing the new AMCP programme. So with your permission, we can keep you posted on that, but if you'd rather not, just drop us an email and we can take you off our list. So I
guess there are lots of questions, and you know, I started off, Maria, by saying that we understand that the sector is is just massively hungry for information about LPS and the improved mental capacity professional role. And people really want the flesh on the bones of the MCA amendments. They want a code, they want regulations. So obviously we can't answer those questions, but you know, that information is coming online, and it's coming online, you know, all the time. So ADAS have got a Q&A session, so you can keep up to date with more information via those kind of normal links really that you might already access. But if there's any questions about the study itself, we're happy to answer those, or we can wrap things up.
Okay, so there was, sorry, this message from Kane, I missed the beginning, but wondered if there'd been an assessment on the impact of frontline staff workload with the introduction of this new set of requirements which LPS places on them.
I think so. The government have done a couple of impact evaluations, haven't they, in relation to LPS? I guess what our study looked at really was people's, you know, the experience within the organisation and the professional stakeholders' experience of the potential impact of the AMCP role. And if you miss those slides, that they'll be available on YouTube. But there have been impact assessments published by the government, certainly in relation to LPS.
I think hopefully what we think is one of the strengths of our study is actually, rather than, as Simon was saying, a top-down approach, this is very much a bottom-up, because I think as frontline practitioners working with MCA, BIAs, and obviously the new role, often those voices aren't heard. So I think that's a passion of ours, that we've been able to work with our colleagues in these local authorities to try and bring that bottom-up view, so to speak, that can kind of feed in, and we can share these findings, that people's voices are heard. Some of the challenges, but also, you know, the motivation and the commitment that was coming through so strongly in our findings around people wanting to embrace this role as well. We're able to share the PowerPoint. Yeah, we will have this will be posted on YouTube. So you'll be able to get the presentation. That should be up in the next day or two. So you'll be able to access the presentation, the slides, and all the information there. So sorry, Ricardo, are there suggestions in the study of how to overcome the possible barrier concerning the reality of the implementation will result in less focus on the person at the centre of the process? So I think, Simon, there was a feature there, wasn't it, in our findings?
I think it was more about concern, Ricardo, that was voiced by some participants, that the kind of mainstreaming of the mainstreaming focus of LPS might sort of dilute the current BIA role. But there was also some enthusiasm, actually, that there were opportunities to really focus on rights-based approaches, and there are opportunities and enthusiasm to upskill the mainstream workforce. So I don't think it's a kind of a fait accompli that there won't be a person-centered approach. I think that's not the way that we would look at the findings. But I guess it's raising questions and some concerns that, you know, these professional stakeholders have about potentially the role of the BIA being diluted. But I think, yeah, as I said, there's encouraging signs from the sector. The conversion course from BIA to AMCP, from what I've seen a snapshot of that at a webinar a couple of weeks ago. I can't remember which one it was, but those signs are really encouraging, actually, in terms of what that syllabus structure might look like. So I think we don't need to, you know, I think we can't assume that this role won't involve a kind of person-centered approach, because I think that's the emphasis is the opposite, actually. Is there another question?
Yeah, there's another question from Beth really about did we get an opportunity to include care homes as part of our research, you know, and tips on imparting information to those settings where staff maybe don't have access to IT as easily. I think for us it's a small scale study. There's just myself, Simon and Rebecca at this early stage. So we were kind of limited really in terms of how we can access. But I do understand as part of the consultation process that the care homes obviously were consulted in that. But absolutely, it's such an important part, isn't it, Beth? So I absolutely agree with that we need to make sure that we're involving care homes in this whole process. But for the purpose of this study, for us as individual researchers, it was beyond our scope at this stage. But we are hoping that this study, you know, raises questions and that it may lead on to further exploration around the implementation of this. Simon, was there anything you wanted to add?
No, not really. Just one of the kind of findings, that thing that came up consistently with participants was a lot of enthusiasm for the sort of policy rollback that occurred in relation to the proposed increased role for care home managers in the process. The government rolled back on that, and there was a lot of enthusiasm from participants who felt that was the right decision. But certainly, as Maria says, in terms of a larger scale study, looking at a really diverse group of stakeholders and understanding their experiences, then care home staff will be part of that.
Great, thank you. And some good links in there and some information in the chat. Thank you for those of sharing your knowledge and sharing that with others. I'm sure it'll be really helpful to follow up. So, sorry, Jane's asking, do we know how long the conversion course is for? At the moment, Simon.
I think, yeah, I think it's going to be, and don't quote me, there may be people on this call who can actually provide much more useful information than me, but I believe it's going to be 2 days. But I'll add the caveat that I'm not confident in that, and that if there's anyone on this call who knows more, then please feel free to put that in the chat. But I believe it's 2 days. And as I've said, there's some really encouraging signs from what I've seen in terms of the focus of that conversion course, in terms of an emphasis on human rights.
Okay, so I think those seem to be all the key questions really, Simon. So just a really big thank you from us as a research team, from Simon and Rebecca and myself, for taking the time to join us today and pose your questions. We're delighted that you can join us, and we're really pleased to get this far with the project, and we'll absolutely keep you updated. Our emails are there. As I said, we will be keeping this presentation will be available on YouTube, so you can revisit that if you came late or missed any of that. And also, we'll keep you posted and signpost you when we've actually published the final report, and we'll keep in touch with you about the developments here at Kingston University in terms of our AMCP courses and what we're developing at the moment. So do stay in touch, and we're really delighted that you can come along today. Thank you so much. Thank you.
Yeah, big thank you, everybody.